Hi, my name is Maria. I'm a final year med student at Cambridge, and today I'll be unpacking how the Cambridge medicine course actually works. So I've just gotten to the end of my degree. I've been through it all, so I can explain how it all happens. This will be particularly useful to anybody who is thinking about applying to Cambridge, to anybody who's already on the course and is unsure of what's coming next, and anybody who's just curious. Cambridge has a traditional course in that you have a separate preclinical and clinical component. So with preclinical, it's very similar to how it works for anybody else at the uni. So you have the same 8-week terms, you live centrally in your college, you go to central lectures, and you have exams which are at the end of the year. You also have supervisions, so these are small group teaching sessions. And for those, you usually have to prepare an essay. So usually in preclinical, you'll have about 3 essays that are due in per week. You then have 3 years of clinical, and for these, you're based at the clinical school, which is right by the hospital. So it's a little bit further out from the city centre. But for a big chunk of the year, something they don't tell you about is that you won't actually be in Cambridge at all. They'll just send you somewhere else in the East of England region. So that might be Kings Lynn or Bedford, and you're actually going to have a lot of your placements there. Okay, so now that I've gone through the main differences between the preclinical and clinical sections of the course, I'll go through what happens year by year, focusing on the courses you get as well as the exams. So in first year, you have 3 main modules. These are physiology, known as HOM or homeostasis, biochemistry, known as MIMS or molecules in medical science, and anatomy, which is known as FAB or functional architecture of the body. So for each of these, you have lectures, as well as small group teaching sessions or supervisions where you go over the material. So for HOM and for MIMS, you have practicals that you have throughout the term. So for HOM, these include cutting up worms, electrocuting things, and going on an exercise bike. And for MIMS, you spend some time in a lab. A big chunk of the teaching that happens for anatomy is actually done on cadavers. So these are people who have donated their bodies to the university for the teaching of medical students. So you have about 2 sessions a week where you do this. It's a privilege to be able to do this, and I know not that many unis in the UK actually offer this as a big component of their teaching, so I feel really lucky to have had that opportunity. It's definitely an experience. So for these main modules, these are all examined at the end of the year. So you have multiple choice questions exams, you have to do essays, and for the practical components, you have some more practical based exams as well, where you might need to do some calculations and do a little bit more lateral thinking. You also have 2 small modules. One of those is on ethics and the other one is on stats, and those are examined at the end of the second term. There isn't much patient contact at all in your first year, but you do have a couple of afternoons that you spend at the GP where you see some patients, and I think you do a home visit as well. So second year is very similar to first year, but it is a step up. So the main modules that you do are neuroscience and human behaviour, human reproduction, pharmacology, which is known as MODA, which is mechanisms of drug action, and you have your head and neck anatomy. So you have the last bit of anatomy, which you actually do in your second year and you get tested then. The other module you have is biology of disease, BOD, which is your pathology section. And very similar to with first year, you have exams at the end of the year. These are your multiple choice question papers, essays, and practical papers as well. All of these are tested at the end of the year, with the exception of head and neck anatomy, which you get tested on in your second term. So with third year, this is your intercalation year. It really varies, so I'm not going to go into too much detail, but there's a huge variety of different things that you can choose to do. So common modules are PDN, so that's physiology, development and neuroscience, psychology, pathology, but you can be very rogue and you can choose something completely different like history of art or law. So the clinical years are very different to your preclinical. You're no longer in the city centre, you're in Addenbrooke's, and a lot of the content is there. You spend most of your time on placement, but you do have some time where you have lectures. So you have a few lecture weeks known as review and integration weeks, or R&I weeks, which are dotted throughout the year. So you might have about 4 or 5 of these, and then the rest of the year is spent on placement. And since your holidays are a lot shorter, so about 2 weeks for Christmas, maybe about 2 to 4 weeks for the summer holidays, you are on placement a huge chunk of the year. So in 4th year, a lot of what you're doing is kind of covering the basics of what doctors do, understanding how the ward works and how to do practical skills. So it starts off with a block called Core Clinical Method, where you learn about how to do these practical skills, how to talk to patients, how the hospital works and what you need to do on placement. Then you have a few rotations. So there's a medicine rotation, there's surgery, emergency medicine, and you have a student selected component which you can choose to do in a department of your choosing. You also have a few weeks of GP which are scattered in as well. At the end of the year, you only have 1 multiple choice questions exam, and you have 1 OSCE practical circuit too. It's very much a general year where you're learning very general medicine and you're understanding the basics of how it all works. On the other hand, 5th year is a lot more specialist. So you have quite specialist medicine placements. So you have your obs and gynae, you have pediatrics, psychiatry and neurosciences. You also have 2 student selected placements. One of them is in medicine and the other one is in surgery. So for me, I chose to do one in plastic surgery and one in dermatology, and it was really nice just getting to do what you want. You also have some more GP as well, but that is scattered throughout the year too. The 5th year exams are quite tough. Those are all at the end of the year. So you have 1 paper with multiple choice questions. You have a paper which is short answer questions. This is quite a beefy long paper with a lot of writing. And you also have 2 OSCE circuits. So one of them is for pediatrics and the other one is for women's health. In between 5th and 6th year, you have your elective, where you get to go and do any sort of medicine anywhere in the world. And this is a lot of fun. You have 7 weeks to do this, and it was a real highlight of my time in medical school. So with 6th year, it's quite similar to 4th year in that you have very similar blocks and it's quite generalized in order to prepare you for your time as an FY1 doctor. The placements that you have are emergency medicine, medicine, surgery, and you also have a long 6-week straight GP block. In terms of exams, they're spread out a little bit more. So you have your medical licensing assessments. So these are national exams, and Cambridge has them in the middle of January. There's also the prescribing safety assessment, which we did at the end of January. And then we had our practical exams, our OSCEs, at the end of April. So we had 2 circuits for that. And then at the end of the year, you also have 6 weeks of apprenticeship where you follow an FY1 doctor, and that helps to prepare you for your job that's coming up in August. So I hope I've been able to sum up how the Cambridge Medicine course works. Hopefully that's made sense and you found that useful. If you have any questions, feel free to drop those in the comments. I'm very happy to answer any of those. But yeah, I hope you enjoyed the video. That is all from me today. Bye. See you next time, guys.